I'm Jonah Comstock, Editor-in-Chief of pharmaphorum. For this month's deep dive on pharma R&D, I spoke with Mohit Manrao, SVP and Head of US Oncology at AstraZeneca. We talked a little bit about R&D trends for 2023 and what his company is working on right now. Enjoy.
We are just connecting really to get an update and hear a little bit about what's going on at AZ right now, or AZ, as my British colleagues say, and what you guys have in the works for 2023. So thanks for joining me, Mohit.
Thanks, Jonah, and thank you for having me. And I'm really excited to share progress that's happening at AZ and in the broader cancer community in actually dealing with this deadly disease.
Yeah, let's actually start with the wider angle and zoom in. From a trends perspective in oncology and cancer, what do you think 2023 is going to be all about? What are people talking about and thinking about in terms of broader technology trends?
Yeah, so I think if we look at the recent American Cancer Society report that came out, it showed great progress has happened in the last 3 decades. It shows that 33% reduction in the cancer-related deaths happened, and it was on the back of personalized treatment and screening. But at the same time, massive health disparities still exist within those improvements. So, and as I projected further in terms of trends, I think those are the trends you would see. You will see trends where outcomes will improve, and again on back of science and innovation moving at pace, on back of new therapies coming at pace, combinations coming at pace. We saw screening rates move the needle in the past. I think that's where, again, now as data, technology, and science meet, there's an opportunity to drive screening and early detection even further up. And as an example, AI-based approaches where, AI could be used on existing scans, whether X-rays and CTs, to accelerate early detection into communities could actually be really transformative, again, in driving those improvements. And then the third trend, I think, would be all around collaboration. How do we do it faster, right? We've all learned a lot about things that can move at pace from the pandemic, where the entire healthcare ecosystem came together to solve for what was unplanned and unforeseen, but that shows us how collaboration can move needle faster. So that's another trend. And last, as I said, projecting from ACS, health disparities remain. So health equity and solving for disparities of care is another trend that, as we look forward, would be absolute focus on. So to me, those are the kind of 4 areas which, as I read the ACS report, resonated very well, where we made progress, but where actually the trends show that more needs to happen. But it's happening in a context which will be more fast, and emergence of or convergence of data technology, science, and collaboration will even move it faster.
So with that as a context, tell me a little bit about what's going on with AZ right now. What's in the pipeline? What are we looking forward to this year? And and if it makes sense to talk about what's happened last year, you can kind of get into that a little bit too.
Yeah, so let's start with that. So if I look at 2022 at AstraZeneca Oncology, or even stepping back further, at AstraZeneca, we are focused on leading a revolution in oncology care with an ultimate goal of eliminating cancer as a cause of death. And to do that, there's one thing which is front and center is understanding the unmet needs of patients and solving for those. In 2022 itself, we brought 7 approvals across 4 medicines for AstraZeneca. A few of them, for example, 3 in breast cancer. All 3 of them were groundbreaking, whether it was Destiny Breast 3, Destiny Breast 4, or Olympia. Then 2 in GI cancers, again, groundbreaking, where the outcomes had been so worse for so many years and nothing worked. We've got 2 approvals in form of Topaz and Himalaya that came in. And then 2 within lung cancer for, again, targeted treatments for HER2 mutant, or those for patients whose disease remains kind of elusive to current therapies with Poseidon and CTLA-4 inhibition. So all in all, 7 approvals solving for unmet needs came last year. And we finished on a quite high with San Antonio SABCS conference, as well as ASH, where we presented new data that will transform care for these patients, for these tumor types and these patients in hematology malignancies as well as in breast cancer. So there's a lot that we achieved and moved the needle on for patients and unmet needs in 2022. As we look further in 2023, what is evident that this is not slowing down. We've got a lot of pipeline and science spanning out, and you will see that, of course, there's a life cycle program across all the tumor types and medicines we are present in. So we've got programs in GI with Emerald 2 and 3, Emerald 1, 2, 3 ongoing, and potentially to be reading out in the coming time. We've got programs in IO lung space. We've got early resectable lung, where we are entering from that perspective. We've got programs in LCM from Enhertu reading out, but at the same time, we've got new molecules reading out. For example, Dato-DXd, our new ADC, TROP2 ADC, which is being studied in lung, breast, and beyond, would be reading out as early as this year. In lung as well as potentially in breast in the coming months. At the same time, we've got our new assets in breast cancer like camizestrant and capi, who are potentially best-in-class AKT, which we presented data for in San Antonio. So there's a lot happening both in terms of moving the life cycle program and multiple indications for existing assets, but at the same time bringing new innovations that will transform care further for these patients.
In terms of mechanism of action, I know there's been a lot of talk about cell and gene, still a lot of talk about ADCs, and a lot of talk about targeted immunotherapies. Which of those buckets do some of the things you're working on fit into, or what am I leaving out?
Yeah. So look, at AstraZeneca, we have a very rich portfolio, and in simplistic terms, and maybe offline we can provide you a visual for that. In simplistic terms, we think of, if we have to eliminate cancer as a cause of death, we need to look at both killing the cancer cells directly, but at the same time harnessing the immune system to deal with cancer. And we have got a diverse portfolio across different modalities that could help kill cancer cells directly, but at the same time that help really actually activate your immune system to deal with it. And the beauty of where science, technology, and data is moving is we have at our disposal opportunities to combine these and move the needle forward. So that's where you could combine an antibody drug conjugate with an immunotherapy. That's where you would have not only a deeper response, but a long-term durable response. And we've got clinical trials with our Dato-DXd and our immuno-oncology portfolio. We've got potential opportunities to combine two checkpoint inhibitor or two kinds of immunotherapies in bispecifics and then combine it with an ADC. So again, we've got trials pursuing in that field. We've got cell therapies being developed for solid tumors that could be off-shelf cell therapies, and then work is ongoing in that space. So there's quite a lot from our direct killing of cancer cells, as well as using the body's immune system, and the combinations that could open up opportunities for treating and actually eliminating many cancers as a cause of death.
So you mentioned health equity at the beginning of the call, and making sure that as we do develop these breakthroughs, that they're improving outcomes for everyone and not just for some people. What are some of the steps you take at AstraZeneca to be part of that solution?
Yeah, so there's quite a so health equity is a broad topic, and there are many elements to it. And I think at the simplistic terms, what I believe we should absolutely do, and which we are doing in multiple ways, is for any medical intervention we bring from a therapy perspective, there's a lot that happens before and after a patient gets to that therapy. And one of the things that I tell my teams is our goal is to eliminate gaps or disparities in quality of care. If there's a guidance and a guideline like NCCN, there's a specific standard of care, we need to ensure that anybody, irrespective of where they come from, where they live in the United States, is able to get a standard quality of care. So that means ensuring the right diagnosis, the right testing, the timely testing, having the right MDT discussions to putting them on drugs, and as well as continuing them appropriately. If we can solve for that disparity, that itself elevates everybody to receive the right standard of care. So there are a lot of quality care initiatives that we drive in with healthcare systems to ensure standardization of that patient pathway and journey and treatment across. Then there are challenges before even the individuals are diagnosed, right? In terms of screening, in terms of socioeconomic backgrounds, in terms of different challenges, different places have. So we've got programs there like Your Cancer, where we work with our communities, where they tackle their local challenges with local projects. So we provide funding for those, we provide guidance for those, but at the same time, we help recognize many of them through awards and recognition, and then actually share and scale them up, help scale them up. There are then screening challenges, and I am something that I'm really proud of is the work AstraZeneca has done along with others in co-founding Lung Emission Alliance, where we are trying to deal with disparities in lung cancer screening and diagnosis as well as outcomes. And as you would know, lung cancer gets very easily associated with smoking. And then with a stigma that you've got this disease upon yourself, and then all the nihilism attached to it. So solving for early detection, as well as that stigma, and ensuring that patients can, or those who need that screening and can be identified appropriately at an early stage, can be done. So there are quite a lot of initiatives that we have driven in the past. But one last one that I like to highlight is the work we are doing in response to the call to action from President Biden and the First Lady Jill Biden in terms of driving screening, right? The Moonshot initiative, and some of the work we are doing is we've started a pilot with the Association of Community Cancer Care, ACCC, which is in the rural Appalachian lung cancer screening initiative, again to solve for those disparities. So there's quite a lot of work going on in each of the tumor areas or therapy areas we are present within oncology to take a leadership role beyond just drug intervention and shaping healthcare equity and solving for those disparities.
And what about clinical trial design? I know that's another area that people are looking at, making sure these trials are representative. Is that something you guys are focused on too?
Yes, so my R&D colleagues think of it day in, day out in terms of solving for clinical trial diversity, because this is what has been talked about, that there's one thing as clinical trials, but then there is a lot of clinical gaps that exist in terms of patients in trials and actually those whom these drugs end up serving. And we have got as an industry a long way to go. But again, working with community cancer centers is where you can really actually develop those. And my R&D colleagues can share more on this with you, but we've got clinical research partnerships with community-based hospitals and community-based accounts, where we are helping open up trials in those communities, which automatically ensure clinical trials are diverse from a community and different elements perspective. So it is one of our top priorities in terms of ensuring our trials are representative of the populations or medicines we'll treat in future. But as you've seen, it's something that is also overarching as part of health equity discussion.
So I'm going to change the subject a little bit. So many of these new therapies that are emerging are highly specific, right? It's precision medicine. It's going to treat someone who has this gene expression of this cancer. And so there's this other piece of precision medicine that's in diagnostics, figuring out who the patients are, who this therapy works for. And one thing that I heard at JPM recently is that that part is maybe has not developed as fast or as far as it needs to accommodate these new breakthrough therapies. So how do you think about diagnostics right now at AstraZeneca when it comes to oncology? You talked a lot about screening, which is certainly related, but how do we make sure we segment those populations to get the most bang for your buck out of these new drugs?
You're spot on. I think one of the things which is critical in terms of moving the needle for patients is really identifying which patients would benefit from which therapies. And sometimes it's done very well in clinical trials, but as it comes to practice, bringing those diagnostics and bringing them to scale and embedding them into practice is where the challenge is. And I think to this point, with most of our therapies, which tend to be in the targeted therapy space, which have got a specific patient identification attached to it, we've done a good job with pathologists to bring the standard of care up in terms of diagnostic testing at as we call it, as a reflex, which is irrespective of the patient. If it's a lung cancer patient, they should get this panel of testing. But again, disparities remain. At the same time, I think even though the even though the pathologists are helping move the needle in terms of guidelines, guidance, quality initiatives, as well as different kinds of tests. That it doesn't have to be just a tumor-based test. It could be a blood-based test, which involves more, which ensures more patients can get access to it without the burden of going through a biopsy where it could be risky for them. The world is moving towards, and we are at AstraZeneca working towards, is a digital pathology where you can actually again digitalize the samples and help AI read those. And where it's going in the future, which we are very excited about, is what we call up is a QCS, which is a continuum of scoring methodology based on a digital pathology scan and an AI algorithm. So I think what we have seen in the past is the pace of diagnostic to catch up with the innovation that's happening within clinical trials has been slower. And this is where the community has been, this is where the healthcare community has been working hard. Where we see where it is going is, again, the same thing that I said is the convergence of data science and technology will help us leapfrog many of the challenges that we face today by really using AI, digital, and kind of cloud-based approaches to identifying these patients early. And we are building some of them into our clinical trials that you would see in the coming days.
So that's a good segue to talk a little bit broadly about innovation and your approach to it. In the oncology group or AstraZeneca in general, I mean, these things are changing so fast. There's so many new technologies, new kind of ways of thinking about it, different parts of the business. How do you keep up? How do you make sure that a big ship like AstraZeneca can still navigate nimbly? And you know what's kind of your approach to innovation writ large?
Yeah, I think innovation needs a thriving ground, and for that, first and foremost, it's an understanding and an acceptance that you can't do all things alone. So collaboration is key part of it. And this is where the example Lung Emission Alliance, this is where the example of AI based like Cure AI, where we are working with them in multiple countries in using that on X-rays and CTs and their AI algorithms. So one of the things for innovation to thrive is the acceptance that we will not be doing it all alone and bringing right partners along. So that's something that is unique or embedded into the AZ culture, collaboration. And we have done that time and again and again during COVID. I think that was also seen at large, whether it was public-private partnership, whether it was partnership between different pharmas, different companies to solve for what the world was facing. The second thing is being truly entrepreneurial and not have layers and layers of bureaucracy come in and move at pace. And I think that's where also something that over the years AstraZeneca has embedded within is a massively entrepreneurial culture. We allow, and we embrace freedom to operate and look for innovative things, and with acceptance that many things may not see the light of the day, but that's where a few will, and that will change the needle. So as I said, the second one is ensuring that entrepreneurial mindset is there. And third one is really truly identifying what are we trying to solve for, and that's where it goes back to the unmet need. If we truly understand the unmet need and collaborate with partners who can solve for those without putting boundaries around our own kind of space, and we then really ensure we are entrepreneurial, we can move the needle on that. So to me, those are the things which are quite embedded within AstraZeneca's approach. And this is where we keep innovating. And you will see very recently at World Economic Forum, we represented AstraZeneca with a lot of partnerships that have come a long way in delivering our sustainability goals. We have worked with many governments on the space of sustainable healthcare initiatives that can help policy changes, but also healthcare systems which can afford what would come in terms of innovation in the coming years. So there's a lot of examples I can go into, but let me pause here.
Well, I wanted to ask you as we kind of come to the close of the interview, what else you want to talk about? What else you're excited about, or you want to take the opportunity to sort of put in front of your peers who might see the video? What's top of mind for you, or if that's something you've already gotten to, then what else is in the mix?
Yeah, Jonah, I think, look, what is top of mind to me is that we are all in it for the patient. So to me, I go back to we have an opportunity where data science and technology are converging at such fast pace to really think bold and act bold in terms of eliminating cancer as a cause of death and revolutionizing cancer care. We are at that cusp and we are seeing that meaningful impact happening, and but at the same time there is a long runway to go. So to me, we are in an exciting space where science is moving fast, patients can benefit. Our job is to remain focused and really put patient at the heart of everything we do. And I'm really proud of my teams at AstraZeneca, all the way from early discovery to R&D to commercialization, and medical education on ground, that have been working across different tumor types in moving the needle for patients. So as we go forward with a bold ambition to eliminate cancer as a cause of death, I invite my peer sets and other companies to collaborate in that spirit and solve for the challenges that we will see on this journey.
Great. Thank you so much, Mohit, for joining me. This has been really interesting and informative. I hope we can have you back again soon.
Thank you, Jonah. Thank you for having me.